On Thursday, the COVID-19 emergency declaration officially ends, which means changes to certain healthcare policies, most significantly how the nation checks for COVID infections. Now, this emergency order established, you may remember, that at-home tests would be covered by insurance. Now, people with Medicare will no longer receive free tests, and insurers are not required to cover them. For rapid tests administered by a healthcare professional, they could now come with cost-sharing fees and limits on where they can be taken. Now, you may remember that during the pandemic, doctors were allowed to write prescriptions for controlled substances, like Errol, for example, without seeing a patient in person. Well, that temporary authority ends Thursday, but the DEA did announce it will temporarily extend this flexibility as the nation transitions out of the official emergency. Now, two areas that are not changing coverage for COVID-19 meds and vaccinations. Both will remain free regardless of insurance access because they are coming from the federally purchased stockpile. That supplies distribution is unrelated to the order ending, but of course it is shrinking. One other aspect that won't change is the emergency authorizations for the currently available COVID-19 vaccinations, tests and treatments. They will remain available as they are tied to a separate FDA declaration that remains in effect. Tony?
Joining us now is CBS News reporter Alexander Tin. Alexander, thank you for being here. Okay, so with the end of the COVID emergency, testing will no longer be free for people on Medicare or with private insurance. And as Donald Trump famously said, if you don't test, you don't find any cases. So I guess this means there's going to be a steep decline in COVID positives.
Yeah, well, I mean, you said it best. We already knew that people were using COVID tests even before the end of the COVID emergency. So there are a lot of people both inside and outside the federal government that said, okay, well, less people taking COVID tests, not having access to that COVID cases metric that so many people relied on during the emergency. Well, maybe that just doesn't matter as much anymore because so many people, both experts inside and outside the government, are already using other metrics like COVID hospitalizations to track the spread of the virus. But to put it bluntly, also, what we've heard, both inside and outside the government, is that everyone expects it is likely we're going to see future surges of COVID-19. In some ways, this is already what is roughly a seasonal virus. Every year, we've seen increases in COVID cases, hospitalizations and deaths in the late summer, early fall. Then we see another wave of those COVID cases, hospitalizations, and deaths over the winter holidays. Last winter, fortunately, wasn't as bad as the winter prior, but we've seen those surges in that kind of seasonal pattern.
What is the situation with prescriptions? How do they change one's access to them, how they get them, who pays when this emergency ends?
Yeah, well, there's two buckets. One of them is the prescriptions for controlled substances that has been the subject of so much controversy. And that's because during the COVID pandemic, the DEA granted some flexibilities to telehealth providers to say that you can prescribe these controlled substances, for example, medication for opioid use disorder, without an in-person visit, just through telehealth. The DEA initially said that after the COVID emergency was over, they would pull back those flexibilities and require an in-person visit. But after thousands of comments, the DEA says it was a record number of comments and feedback, most of it opposing that change. What we've had instead is the DEA saying, we're going to pause that change, we're going to extend those flexibilities and reassess our approach to that. Totally separate from that is prescriptions for things like Paxlovid, that's Pfizer's COVID pills. Those will remain free for now because they're coming out of a government stockpile that was paid for already by the Biden administration. But at some point later this year, we expect that to go to the private market. That means the same old things that people go through to deal with their insurance, to deal with their healthcare providers, to get a prescription, and eventually to get those drugs. But again, to be clear, that change is not happening with the end of the COVID emergency. We don't expect that to happen until much later this year.
Okay, and when it comes to vaccinations and coverage thereof, no change as I understand it. So I guess the question then becomes, shot number 5, should people have it? If they don't have it yet, should they get it soon? I'm guessing if they don't have, some people are like, I'm not on 2, right? I'm on 1 still.
Yeah. Yeah, well, this is interesting because there was recently a change that was green-lighted by the FDA and the CDC that makes it pretty simple, if it wasn't simple enough already. If you didn't get that updated bivalent booster shot that was revised last year to target the Omicron variants, you are recommended to get that one shot. That includes people who are unvaccinated and got no shots before. That includes people who got tons of shots before the bivalent shot. If you haven't gotten that bivalent, you're recommended to get one now. And if you're an older adult or immunocompromised, you have the option to get a second of those bivalent shots. Again, those remain free for now, but that is something that will probably change later this year. We are expecting an FDA meeting over the summer that's going to decide on another seasonal revision for those booster shots. And so when those roll out in the fall, that will be from a supply that hasn't been paid for by the federal government.
All right. Alexander Tin, all things COVID for 3 years straight and counting. Thank you very much.
Thank you.